Good afternoon. I'm Darrell West, Vice President of Governance Studies and Director of the Center for Technology Innovation here at the Brookings Institution. And we would like to welcome you to our discussion of 5G networks and the Internet of Medical Things. And we are webcasting this event, so we'd like to welcome our viewers from around the country and indeed around the world. We have set up a Twitter feed at hashtag HealthIoT. That's hashtag HealthIoT. So feel free to post any comments or questions that you have. We are at an interesting point in the history of healthcare. We are on the verge of a technology revolution with the potential to transform a number of aspects of healthcare. Soon, our country, as well as other countries around the world, will be rolling out a new 5G network that will bring together an estimated 50 billion devices and 212 billion sensors. There will be fast, intelligent networks that will handle the traffic flow, and there will be cloud-based services that will allow applications to process content quickly and effectively. This is going to enable many new approaches in healthcare in terms of imaging, diagnosis, and data analytics. It's going to be possible to get second opinions remotely, far from where people live. Sensors will help people track various symptoms and electronically transmit that information to their health providers. Data analytics will generate actionable insights in real time so that physicians can learn about what works and what does not work. So these new tools and new network will improve access to medical care, and the hope is that it will do so at an affordable price. We actually have put out a paper summarizing some of the new developments in terms of 5G networks, and we also make a number of recommendations for using 5G networks to improve healthcare. And just to quickly summarize some of those ideas, we emphasize developing the digital infrastructure so that we can gain the benefits of a 5G Internet of Things, harmonizing the spectrum so that there is a combination of licensed, shared, and unlicensed spectrum, using technical standards to ease concerns regarding interoperability and getting all these devices to connect with one another, balancing technology innovation on the one hand with effective regulation on the other, and then finally altering government reimbursement policies to encourage telemedicine, video conferencing, and other kinds of home health therapies. So if we do these things, we argue that we will move much closer to the world of connected medicine and that it will help to improve healthcare for all of us. So today we are bringing together a number of leading experts to discuss the future of healthcare and particularly the role that technology can play in that. We're very pleased to welcome our first speaker, Julius Knapp, who is the Chief of the Office of Engineering and Technology at the Federal Communications Commission. And in that position, he leads the Commission's activities on technology innovation. He is the Commission's primary resource for engineering expertise and technical support for the chairman, the various commissioners, and the various bureaus and offices. So please join me in welcoming Mr. Knapp to Brookings.
So good afternoon, and thanks, Darrell, for that introduction. I was invited to speak here a few weeks ago to talk about 5G and the Internet of Things and what it would mean for healthcare. And at the time, the FCC was planning to adopt new rules for 5G on July 14th. But sometimes your best laid plans to have something adopted on the date slip a little bit. So there was some risk in accepting the invite that the Commission would actually vote to adopt the new rules, and then otherwise I wouldn't have much to talk about today. But thankfully that happened, and the Commission delivered on its plans to provide for 5G in a big way. So last Thursday, the FCC adopted new rules for wireless broadband services in the frequencies above 24 gigahertz, which made the United States the first country in the world to make the spectrum available for next-generation wireless services. FCC Chairman Tom Wheeler said at the time, it's probably the most important vote that the Commission will take this year. At the Commission meeting, the Chairman and Commissioners talked about, we don't know exactly what 5G is going to be. And here we are today, just 5 days later, talking about what 5G is going to mean for health. In preparing for today's session, I had the pleasure of reading Darrell's paper that offers insights into the promise of 5G technology and how it will enable the Internet of Things in the context of health. The paper, among other things, talks about the need for spectrum, development of industry standards, and effective regulation. So let me start with spectrum. And I beg your indulgence for those of you who aren't spectrum geeks. We made spectrum for 4G available early, and as a result, the United States was the first nation to deploy 4G networks at scale. Because we led in networks, we led in users. And because we led in users, developers focused on the US market. Today, 91% of the world's mobile app downloads are from US businesses. The result has been a mobile app economy that created 1.6 million new jobs. We're repeating that same formula for 5G. 1, make spectrum available quickly and in sufficient amounts. 2, encourage and protect innovation-driving competition. And 3, stay out of the way of technological development. 5G is not going to be about one frequency band, or even two. 5G requires access to low-band, mid-band, and high-band spectrum to achieve coverage and capacity to meet the growing demand for access to wireless. And all are available in the United States now through flexible use of the existing wireless frequency bands and the addition of new bands in the last few months. The low-band spectrum at 700 megahertz that first fueled 4G in the United States was reallocated from TV broadcasting. We are currently conducting the world's first incentive auction in the TV spectrum at 600 megahertz to make more low-band spectrum available. Last year, we opened up large swaths of mid-band spectrum. Our AWS-3 auction in the 2 gigahertz region generated auction revenues in excess of $40 billion. We also opened up spectrum in the 3.5 gigahertz region for both licensed and unlicensed use based on cutting-edge technology that enables sharing with incumbent radio services. The Commission's action last week made available licensed, flexible, high-band spectrum at 28 gigahertz, 37 gigahertz, and 39 gigahertz that totals more than 4 times the amount of flexible use spectrum that the Commission has licensed to date. And let me just repeat that. More than 4 times the spectrum that is fueling wireless today. And we didn't only make spectrum available for licensed. We also added spectrum in the 60 gigahertz region to open up a huge 14 gigahertz of spectrum for unlicensed use. And just in case all of that wasn't enough, we've proposed additional bands totaling more than 18 gigahertz of spectrum. So we're not done yet. Even with all that we've done, we've proposed to make additional spectrum available. When it comes to the development of standards, terms that might be familiar to you as GSM, CDMA, and LTE, the Commission for more than 20 years has relied on the private sector to develop those standards. We're following that same formula relative to the development of standards for 5G. Organizations such as the International Telecommunications Union, 3GPP, and the IEEE are already well along the process of developing standards for 5G. The steps the Commission took last week will exercise our responsibility to make sure there is a competitive environment that furnishes the incentive to drive competition and bring new services to the market. We're also making sure that industry takes into account, right from the beginning, the need to build cybersecurity protections into the standards right from the start. And that's got to be very important, especially in the healthcare industry where you need reliability and immunity from attacks. Our nation is also investing heavily in research and development for 5G. All of the major U.S. carriers are conducting or plan to conduct 5G trials. Just last Friday, only one day after the commission meeting, the Office of Science and Technology and Policy and the National Science Foundation announced the creation of the Advanced Wireless Research Initiative with a substantial investment in fundamental research of wireless technologies that would support the development of 5G. This initiative is going to establish platforms for advanced wireless research that is enabled by a new industry consortium that's going to include both public and private partners. Earlier I said that we don't know exactly what 5G is. What we do know is that it will provide high-speed, high-capacity, low-latency wireless networks. Well, what does that mean for the health sector? In the past few years at the FCC, we've been gratified to help enable a variety of new wireless medical applications, medical telemetry, microstimulator devices that restore motion for those suffering from a wide array of debilitating disorders or injuries, medical body area networks, diabetes monitors, implantable devices for weight control, hearing assistance devices, and devices that restore a level of sight to persons who have no vision. That's just to name a few. And I should mention that we do all of this work in coordination closely with the U.S. Food and Drug Administration. We actually have a memorandum of understanding with them. We meet 3-4 times a year, and we have a constant dialogue in between. 4G brought together the wireless and health sectors in ways that weren't possible before. Short-range devices that operate at only a few feet could suddenly be connected over the internet via a smartphone to a remote location anywhere around the globe. Today's networks have the capability to remotely monitor a variety of patient conditions for purposes such as cardiac care and diabetes management. All sorts of novel healthcare applications have been developed. For example, small wireless sensors in shoes can monitor the gait of an elderly person and send a signal to a relative that they may be at risk of a fall. These sorts of applications are sometimes referred to under the term the Internet of Things. Whether we are talking about connections between people or things, it is fundamentally about the ability to connect with anything or anyone, anywhere, at any time. And when it comes to the health sector, the connectivity that 5G promises to open up a new world of possibilities. Imagine having the ability to perform surgery remotely, enabled by 5G's capability for real-time interaction, coupled with virtual reality. Imagine being able to transfer high-resolution MRI images to a physician wirelessly in seconds, not minutes. Imagine sensors that can collect and send far more data about a patient's condition than can be done today. Better still, imagine sensors embedded in wearables that could serve to identify health issues at an early stage when they're more easily treated. Darrell's paper provides many more examples of potential applications, yet no matter what we imagine today, we can be sure that it will fall short of the innovations to come. In closing, let me also recognize that where technology provides new opportunities, it can also foster the need to re-examine existing policies. For example, it was an eye-opener to me to read in Darrell's paper that today reimbursement is only provided for health care when the physician is there in person. So I look forward to the discussion this afternoon. We've made the spectrum available. The technology is being developed. and all that's left for us to do is to take advantage of the wonderful opportunities for the betterment of healthcare for everyone. So that sounds pretty easy. So thanks for listening, and I'd like to introduce Bob Rogers of Intel. Intel was very active in our 5G spectrum proceeding. They've been one of the leaders in this space, and I know that they've been working on some very exciting products and the supporting technology that will be the engine that drives other innovations. So, Bob, thank you.
So as just mentioned, our next speaker is Bob Rogers of Intel. He is the Chief Data Scientist for Big Data Solutions. He's someone who's very knowledgeable both about healthcare in particular and the topic of data analytics. And I also want to note we appreciate the generous support provided by Intel for this discussion. Bob, we look forward to hearing your comments.
Thanks, Daryl, for your very kind introduction. I really appreciate it, and I'm actually quite thrilled to be here to speak to you all. And thank you, FCC Chief Knapp, for your very insightful comments on FCC's work to really enable this technology and ensure that the U.S. has the resources and spectrum needed to continue our technology leadership as we move towards the next generation of technology innovation. The Commission's recent decision making so-called millimeter wave or millimeter frequencies available for new 5G applications demonstrates the global leadership that we need and is attracting substantial 5G investments and experimentation in the U.S. In fact, those, again, borne out by Mr. Knapp's comments about the amount of research that's happening. As a technology provider, Intel is really honored to have the opportunity to support the Brookings Institution in this work and in their examination of the impact 5G will have in the years to come. Brookings has been a leading voice in examining how technologies can impact and transform our world. It's been a privilege for me, and I think for the rest of us at Intel, working with Daryl to explore the effects that 5G and the coming Internet of Things will have on industry and on people's well-being. At Intel, we believe that the world is becoming increasingly smart and connected. Our vision is a world where every aspect of life is integrated into the network through a variety of connections, not just mobile broadband, but through an Internet of Things and applications generating huge networks of machine-to-machine communications. This smart connectedness is going to place unprecedented demands on today's wireless networks, and it will really drive the need for 5G. So 5G and the Internet of Things are going to transform the ways we interact with our world. They'll infuse intelligence throughout the network and bring seamless connectivity and computing power to every person and thing across our society and our environment in which we live. At the same time, the Internet of Things promises to create new services and solutions that will affect nearly every part of our lives. We'll move beyond the current connection form factors that we have to see everything in our lives connected. Of course, our smartphones and our vehicles, but also our homes, the places we work, where we travel, and in fact, even the devices that we wear on our bodies for our own well-being and healthcare. More than just connecting those sources of data, we're going to see that the billions of things brought to life by 5G will create an intelligent computing environment that allows us to pursue grand aspirations, such as finding more productive ways to feed the world. That intelligent computing fabric is critical to how we take advantage of 5G. The ability to connect things that were never connected before will lead to new insights that have the potential to materially and meaningfully impact all of us. And I believe, and I think we all believe, that this will be particularly important in healthcare. Today, commercial networks and devices already allow some new forms of care delivery. However, mobile health and telemedicine are limited by current 3G and 4G mobile broadband and by application and device limitations. The connected Internet of Things is going to change everything. By design, it will not only increase capacity, it will enable even the smallest devices to perform heavy computational tasks, connecting rapidly and opportunistically to processing power that will be diffused throughout the network. Again, a really critical point when we envision the future world of 5G and the connected Internet of Things. In healthcare, we may soon have the capability to enable things such as remote diagnostics and even remote surgery. And I have to say, I was a little hesitant to talk about remote surgery because it seems so far off, but then when Mr. Knapp brought it up, it gives me great comfort. And I think we're all aligned in our vision here. So these require high bandwidth communication, low latency, and very, very high reliability, all the way down, and the latency down to millisecond level. We're also going to see just-in-time delivery of care, powered by seamless integration of data and analytics. Imagine a world where patients receive the care they need, where they need it, and when they need it. Imagine the impact that this will have on patients suffering from chronic conditions, where trouble with coordinating data and services is a huge challenge, and also patients who are in resource-scarce areas, where it's challenging to get access to centers of care. And smart pharmaceuticals will certainly be possible thanks to the real-time capabilities of 5G. Not only can pharmaceuticals be embedded in connected devices, but they themselves will be the connected devices, creating the capability for a patient's condition to be assessed in real time and medications to be titrated remotely. Intel, in partnership with Michael J. Fox Foundation, has already developed a system to monitor and interactively assess the highly variable symptoms of Parkinson's patients to improve our studies of possible therapies. In a more connected world, the scope, scale, and impact of these studies will expand dramatically, allowing us to better control the dosing and outcome of therapy. 5G is also going to bring transformation in the use of big data, which means great things for diagnosis and treatment. Data analytics, enabled through 5G, will be able to aggregate, analyze, and make sense of data in new ways, making every device smarter because it's connected to the cloud. Today, there's an incredible loss of valuable information in healthcare. In a healthcare system enabled by 5G, data silos and a lack of semantic interoperability will not be tolerated. In fact, this is the promise of precision medicine: secure access to the right information about each patient so that the best care can be provided. And some of this can be done in real time, accessing comprehensive analytics that can determine treatment regimens at the point that they are needed. As Intel's chief data scientist for big data solutions, I'm looking at all the ways that data will be used today, and I'm particularly interested in the ways that data will be used in the future. So with that in mind, I'd like to just tell one short story from my own experience that will be enabled by 5G. This is the story of the unconnected ultrasound. So recently, I was sitting with my wife while she had a kidney ultrasound. And of course, me being me, I couldn't just let the technician do her work. I had to ask her about the device she was using. So I asked her, "What do you think about this device?" "Well, it's okay, but it's not as good as the other one that we use." And I said, "Oh, really? Why not?" And she told me, "On this one, the algorithms are wrong." wow. I was amazed and thrilled, partly because I never get to use the word algorithms in my real life, but also because this was a challenge right here before me that's right in my wheelhouse. So I asked her what the problem was. She said, well, look at this artery right here. We automatically measure the diameter of the artery. But 40% of the time, this one gives me the wrong number. I have to go into the system and I have to change the record with the correct number every single time for that 40%. This was a huge light bulb moment for me because as a data scientist who uses machine learning, I saw that this unconnected ultrasound was missing the boat for advanced analytics. They have an army of technicians entering data to correct their algorithms in real time. And because the system is not connected, that data goes nowhere. The opportunity to use machine learning to improve algorithms and to advance our ability to measure accurately in complex cases, completely missed. Obviously, a connected ultrasound changes that story. But it goes one step further. Imagine now if that ultrasound fits in the palm of your hand. That's potentially revolutionary. The life-saving power of ultrasound diagnostics that can go anywhere they're needed. But it also raises a challenge because right now, ultrasound is done by experts. And if I can take it anywhere and anyone can use it, we need some way to guide those users. 5G and an intelligent connected system allows us to take into account context and to, in real time, provide intelligent guidance for non-experts to provide life-saving data acquisition at the place that it's needed. Here at home, in other developing countries, it's a very, very powerful image of where we're going with this connected story. So this type of capability will be pervasive across healthcare, and the day of the unconnected ultrasound will be no more. Everything will be connected and intelligent. So, sounds fantastic, but there's a lot to do. These billions of devices are going to have widely varying capabilities and data and power demands. We need a network that connects all of them intelligently and takes into consideration the use of power, data demand, and spectrum. In that regard, the FCC will need to continue to make low, mid, and high spectrum bands available in a flexible and investment-friendly manner. I'm not looking at you. And it sounds like we're on that path. Work is already underway to standardize solutions that will use existing footprints, enable global coverage, and allow for solutions to be scaled quickly. So we're on the path. Just to summarize, 5G and the Internet of Things promises to ignite opportunities across many industries and fuel innovation in nearly every part of our lives. I look forward to hearing from the panelists today, and I have to say in the green room, the conversation was already really outstanding, so I'm really looking forward to hearing this. These panelists will provide their perspectives on what this paradigm shift will mean for healthcare. Thanks again to Daryl West and the Brookings Institution for recognizing that a technological revolution is underway, a revolution that will impact not only our industry, but all industries, all services, and all people. Thank you.